the member from Macquarie Fields.
Thank you very much, Acting Speaker. A conversation is a simple act, but it can also be powerful enough to help save a life. Talking with others about issues that affect us, we realise that we are not alone and that our individual struggles are shared by many, and that there are people who care, and more importantly, there are people who can help. Since being elected, I've been committed to facilitating more opportunities to converse about mental health. Increasing our conversations about mental health can break down stigma, raise greater awareness, inspire action to boost resourcing, and improve mental health services for those affected, in addition to their families and carers. Conversations about mental health need to become normalised everyday conversations, similar to how we discuss heart disease, asthma, diabetes and other health ailments. Why? Because mental health matters. I was pleased to help continue this important conversation on mental health at my second Mental Health Matters Forum. The focus of this year's forum, held in June, was body image and eating disorders, highlighting this often complex and deadly mental illness. More than 70 people braved a cold evening to hear from a range of informative speakers, including one brave woman, Diane McLaughlin, who shared her own lived experience with an eating disorder. The eating was also an opportunity to connect with a range of local health service providers, ask questions and share information. The success of the eating followed on from my inaugural Mental Health Matters Forum in 2017 on young people and anxiety, a catalyst for more opportunities to raise awareness of mental health. I was proud to facilitate my latest forum in partnership with local mental health advocate Ms Sandra McDonald, One Door Mental Health, Beautiful Minds, Headspace Campbelltown, the Southwest Local Elder Health District and the Butterfly Foundation for Eating Disorders. This collaborative approach highlights the complexity of eating disorders and the importance of health practitioners working together and taking an individualised approach to treatment and recovery. More than 1 million Australians live with an eating disorder, with concerns over body image ranked in the top 3 concerns for young people. Anorexia has the highest death rate of all psychiatric illnesses, yet people with eating disorders can make a full recovery if they get proper treatment. Eating disorders are complex mental health illnesses that require a collaborative approach amongst all those that care and require support. Research suggests that as many as 97% of people with an eating disorder have at least one other psychiatric diagnosis. The most common of these are depression and anxiety, including OCD and social anxiety disorder. Earlier this year, the Butterfly Foundation highlighted the crippling cost of eating disorders. A staggering 1 in 3 go into debt to treat their eating disorder. Affordability and accessibility are barriers to seeking treatment. This must change to help those in need. The impact of negative or unrealistic body image on a person's well-being cannot be overlooked, especially the increased access to the various marketing channels. Promoting positive body image is a vital prevention initiative against eating disorders, and such programs must be made a priority. It's important to remember that everyone's experience of an eating disorder is different. The Butterfly Foundation recently ran an online campaign asking people to share their experience about eating disorders. Here's what some of them had to say. My eating disorder has nothing to do with wanting to be thin. Another, just because we might look a normal weight, it doesn't mean we don't have an eating disorder. I'm at war with myself every day. Regardless of your weight, you are worthy of help. Let us pause for a moment and consider that 4% of the Australian population is experiencing an eating disorder, and that the estimated socio-economic cost of this is around $67.7 billion. We must act now to provide more services to improve access and treatment options, early intervention programs, and promoting more naturally realistic positive body images. Greater awareness of mental health in our community will help to dispel some of the myths that exist around eating disorders. This leads to not only to a more accepting community, but also improves prevention, early identification, and encourages those to seek help. This is why the conversation around mental health must continue in our local communities and across the country. The more voices that are heard, the more doors that will open and the more lives we can save. Together, let's continue the conversation because mental health matters.
I thank the member for Macquarie Fields. And